Winter weather is on the doorstep, and we've got the tips to make sure you're ready for winter travel. Joining us for more, including how you can stay safe while hunting and things to keep in mind during a physical at the doctor's office, is Trauma Outreach Coordinator Tracy Dethlefs-Rademacher of CHI Health, Good Samaritan Hospital of Kearney. Tracy, when we hit the road this winter driving season, what should we keep in mind?
Some of the quick and easy tips that we can all remember to do are to start off by making sure that your car is in good road condition for winter travel. Also, check road conditions before you leave. If there is bad weather, let someone know when you're leaving and what route you expect to take. Have your cell phone fully charged and take an extra charger along with you. And it's time to put that emergency kit in the car that could include an extra hat, gloves, blankets, hand warmers, and even some non-perishable food and water. Make sure your windshield wipers work and that you have a full reservoir of the anti-icing fluid. We don't often think about it, but don't forget the sunglasses. Glare of the sun off the snow can actually be worse than in the summertime. Also, drinking and driving never mix, and don't forget to wear your seatbelt. We should also know safe driving practices for those winter road conditions. So allow some extra space between vehicles, slow your speed, don't use cruise control when the road conditions are icy or wet, and always look and steer where you want to go if a skid should happen. Take your foot off the gas and don't overbrake. And remember, four-wheel drive does not really help on ice, so just slow down. Should there be an accident or you do become stranded, stay with your car if at all possible. You could tie a bright-colored bandana on the antenna or windshield wiper. That would signal to someone that you are there in the car. And don't forget to clear the snow from your tailpipe or muffler if you get stranded in the snow and you need to run your car intermittently. Most importantly, stay home if you don't really need to venture out.
Hunting season is underway. Tracy, what do you have for tips on how to stay safe for our local hunters?
Yes, here are some hunting safety tips to keep in mind. Always tell someone where you're hunting. Dress for the weather, and when hunting with a firearm, you must wear the hunter's orange. Never hunt alone. Check your equipment regularly and maintain it well. Be aware of what your target is and what is in the background of your target. Be in control of your emotions, wear hearing and eye protections, and don't hunt while under the influence of drugs and alcohol. These substances can impair your judgment. And the biggest takeaway is to always assume any firearm you come into contact with is loaded. If you remember that, you greatly decrease your chances of accidentally being injured when handling a gun.
We're talking right now with Trauma Outreach Coordinator Tracy Dethlefs-Rademacher of CHI Health, Good Samaritan Hospital of Kearney. Tracy, the year winding down, which means many people are trying to fit in those last-minute doctor visits to meet their health care deductible. Are there some things we should keep in mind?
In the past, most medical groups advocated for an annual health exam. However, more recently, the American Medical Association and other small groups have moved away from the yearly exams. Now they suggest that medical checkups be referred to as periodic health assessments or examinations, and that they can be performed every 5 years for any adults over the age of 18, until about age 40, then every 1 to 3 years thereafter. The evaluations are more frequent for those people that are taking prescription medications or diagnosed with a health issue. Regular health exams and tests can help find many problems before they start. They can also help find problems early when your chances of treatment and cure are better. Which exams and screenings do you need? Well, that depends on your age, health and family history, and lifestyle choices, such as what you eat, how active you are, and whether you smoke or use tobacco products. To make the most of your next checkup, here are some tips of things that you could do before you go. Review your family health history. Find out if you're due for any general screenings or vaccinations. And also write down a list of any questions or problems you might be concerned with to take to your physician. For many of you that don't do the routine checkups, it's time to take charge of your health. Schedule an appointment with your healthcare provider to discuss what screenings and exams you need and when you need them.
Tracy, what can you tell us for some final thoughts?
With our Midwest winters upon us, here is a number to keep handy or programmed into your phone. For the Nebraska road conditions or travel information, you can dial 511. You can also look up current road conditions on the internet, and of course, keep your radio tuned to 880 AM KRVN. Safe driving, everyone.
Thanks, Tracy. That's Tracy Dethlefs-Rademacher, Trauma Outreach Coordinator for CHI Health, Good Samaritan Hospital of Kearney, offering suggestions for winter driving, hunting safety, and end-of-the-year doctor visits. To hear this interview again and many others, you can click the podcast tab at krvn.com. I'm Paul Perkins on the Rural Radio Network.